Hello. So today I'm going to talk about dialectical behavioral therapy, um, which is in the name. The dialectic is something that is a sociological term used for something that is weighing facts or ideas that contradict with a view to solve contradictions, or also which also means change. Um, so changing yourself from what you used to believe is what dialectical means, and why this and that's what this therapy is about, is changing your views and your emotions, and trying to, if there's such strong emotions, trying to change them to be a lot lower and a lot less. Um, so this I interviewed Kirsten at the Haven Kids in Omaha, Nebraska. Kirsten works with children and adolescents, and she has been trained in dialectical behavioral therapy for 2 years now. Kirsten had taken a class which she completed online 4 hours a week, and she completed this class in 6 weeks. She described that the class was at your own pace and something that you can complete faster if you wanted to. Um, Kirsten has a degree in psychology from UNO, and she got her bachelor's in family sciences also at UNO. We talked about dialectical behavioral therapy, and she told me that it is a course that is either 12 weeks or 16 weeks, that it also varies in the time that of depending on the program of how long it'll take. Kirsten stated that it is a course that you should expect a lot of work, because there are three components to this therapy. There is group therapy, individual therapy, and family therapy. And in group therapy, they complete worksheets about skills. In individual therapy, they focus a lot about themselves and what they learned in group and how they can integrate that in their lives. In family therapy, it's used a lot more for adolescents and children, due to it's easier for them to build relationships with their family, since they're most of the time still living with their family or guardian. In dialectical behavioral therapy, they focus a lot on feelings and coping mechanisms that are healthy for the client to use, instead of the unhealthy coping mechanisms. So dialectical behavioral therapy is used for many types of disorders and issues that people may have. It is used for suicidal ideation, which is thoughts or beliefs, or people hurting themselves and want to hurt themselves. Um, DBT is also used for borderline personality disorder, which is super exciting, because this is one of the very few treatments that is used for this disorder. So it's very exciting for people to actually be able to have treatment. It is also used for difficulties in emotional regulation. So people who struggle with regulating their own emotions, or having really high highs or low lows, this treatment is used for them. So in dialectical behavioral therapy and group therapy, they will use modules that will also integrate in their family therapy and individual. But they do worksheets in group therapy about the 4 modules, and learning about them. The first module is mindfulness. This module is about learning how to cope with your environment and learning skills to deal with the issues and struggles that are in your environment, and how to deal with them. The second module is interpersonal effectiveness, which is learning how to deal with chaotic or toxic relationships in your life, or relationships that are not good, even if they are with family members. So that module is learning skills, how to deal with that. The third module is emotional regulation, which is teaching skills about how to identify, understand, and cope with difficult emotions that are arising. So that's a really important module. The last module used is distress tolerance, which is pretty self-explanatory, but it is a module that teaches skills that help decrease like pain, or when you're in crisis mode, to decrease some of the emotions you're feeling and try to get healthy coping mechanisms in your life and try to make that into a habit. So that one's really important, just like they all are. And it's really important that DBT, this goes along with the stress tolerance, that DBT, a lot of the therapies, most of them do include phone coaching, which phone coaching is that the therapist will always be 24/7 available if you're ever in crisis mode, or if you need something, or if you're ever feeling in a way that you shouldn't be, that is bad. And so it's really important to realize that they're always here for you. And I love that part about dialectical behavioral therapy. So the goal to dialectical behavioral therapy is for clients to live the life that they feel is worth living, which is really powerful due to how strong the emotions that these people can feel is. And I think that that's a great goal. So in DBT, I selected this intervention because this was something I had never heard of before. It was something I had never came across until I was researching on the web some different treatments for suicidal behaviors and ideation. And I came across this, and then I thought this was probably the best thing I'd ever read, and I've been looking into it ever since. This intervention is really personal for me because this is something that I had dealt with in my family, and so it's something that really hits home for me, and I would love to learn all of the different treatments for people who struggle with suicide and suicidal ideation, because this was something that happened in my family. So this is something I really want to work on, and this is why I want to be a social worker. So this is really important to me, and I think this is a really great intervention that I love learning more about. My preliminary evidence-based practice question is dialectical behavioral therapy the most effective treatment in reducing suicidal ideation in adolescent girls experiencing any type of suicidal thoughts or ideas? That is what I have been kind of looking for, and something that I would like to find out. And so in my paper, and I will explore more on that. So if you have any questions, email me, let me know. I'd love to talk more about this, but thank you so much for watching.